Our dental profession has devoted most of its history restoring the effects of dental disease. The last 2 decades has evidenced a paradigm shift in this philosophy that has been guided by a greater understanding of science. During this evolution, restorative dentistry has adopted a medical model for decision-making in the treatment of dental disease that allows clinicians to individualize and evaluate all components of the process for a proper treatment strategy. This process also educates and involves the patient in treatment decisions, which results in acceptance of appropriate preventative and restorative strategies and improved compliance and oral health. The public's interest for health and beauty has become an engine that continues to drive the demand for cosmetic dental procedures. In the past, achieving a beautiful smile required submission to extensive invasive procedures and expensive fixed dental prosthetic restorations. Advancements now in restorative material formulations and adhesive technology have expanded the treatment possibilities for the clinician and the technician. In addition, these advances have increased the myriad of opportunities available to discriminating patients and have provided solutions to many of the restorative and aesthetic challenges faced by clinicians. Also, this changing technology allows the clinician to treat many previously aesthetic and restorative challenges through more simple, conservative, and economical methods. This evolution in philosophy and science has resulted in a change in the trend for dental treatment. There has been a shift from patients seeking disease-related treatment to elective cosmetic enhancement procedures. The aesthetics-driven decade in dentistry requires an ever-increasing body of knowledge essential to the process of clinical decision-making for beautiful smiles or aesthetic restoration. This first edition of Aesthetic and Restorative Dentistry, Material Selection and Technique, has been compiled to explain and teach aesthetic dental procedures through illustrations of everyday clinical situations. It's not designed to tout one restorative material as the best or which material a clinician should use. Instead, its purpose is to illustrate how a selected material and/or instrument should be used with a specific and thorough protocol to achieve the highest level of excellence for that material and clinical situation. The editorial team members were selected from different areas of the world for their scientific knowledge and clinical and laboratory expertise. Although I wrote the book, there are 61 members in this international forum, including Luis Barchieri from Brazil, Sherilyn Sheets from Newport Beach, California, Jean-Marc Etienne from Nancy, France, and Galip Gurel from Istanbul, Turkey, Fritz Kopp from Zurich, Switzerland, and Masashi Miyazaki from Japan, Oliver Trick from France, Ian Nagao from Singapore, and as our representative from Johannesburg, South Africa, David Garber, a part of the Atlanta team, and Ronald Goldstein, also from that team. Nitzan Bakacho from Tel Aviv, Israel, and the list just goes on and on. No corner of the continent was left unturned, seeking out the most appropriate reviewers and teachers for the task at hand. This international group encompasses many facets of aesthetic and restorative dentistry, including biomaterials, laboratory technology, operative, prosthetic, and periodontic and implant dentistry. And I believe this combination of input can provide clinicians, technicians, and auxiliaries with the proper information to make improvements in their work while maximizing their productivity and providing improved oral health to their patients. This 771-page contemporary textbook has more than 2,000 color illustrations. The book vividly describes detailed aesthetic and restorative dental procedures and techniques as they are used in everyday clinical situations. It is designed to explain how a selected material and/or instrument can be used as part of a thorough protocol to achieve restorative excellence. With the scientific knowledge and clinical and laboratory expertise of an elect international editorial team, this book encompasses many facets of dentistry, including biomaterials and adhesive dentistry, photography, dental technology, operative dentistry, prosthodontics, orthodontics, periodontics, and implant dentistry. Each chapter is divided into two parts. The first part consists of the latest evidence-based clinical concepts and biomaterials information related to the topic in a clear, concise, and understandable manner. The second section provides step-by-step, high-quality illustration of the associated clinical procedures with no steps removed. The detailed photographic description of the restorative, laboratory, and surgical procedures will ensure proper decision-making and enhanced technique. The first part consists of necessary clinical concepts and biomaterials information needed to understand the various topics covered in this publication. Each topic is discussed according to the latest available scientific information as it relates to materials and clinical procedures. The second section consists of high-quality photographs detailing the numerous clinical procedures associated with a wide range of aesthetic, restorative, and surgical biomaterials. The reader will discover all the information and a step-by-step instruction needed to achieve aesthetic and restorative excellence, which are showcased throughout the book.